Hey guys, here's an uncommon story. Somebody who moved during placement of a Ayres microstent, leaving a large iridodialysis as well as other iris damage. What you're looking at is a fiber membrane over the IOL, a couple areas of hemorrhage. It's a little hard to figure out exactly what's going on with the iris, but I think we've got a dialysis with part of it peeking through a paracentesis. In the superior portion of your view, there's a Ayres microstent, but it's difficult to see. The plan here is to try and remove the iris from underneath the conjunctiva, and then try and free up what's left of that iris and bring it together. We'll probably need to make a peritomy and then do a small dialysis repair. I think that'll get the iris largely reconstructed, but there is one little spot here that I'm concerned about. It's kind of stuck down. The iris is stuck down to the IOL. If we bring that together, I think the pupil's going to be happy. So now that we have this plan to repair the iris, let's see how things go. We'll start by making our usual paracenteses, 1 or 2 for a microforcep, plus 1 for the main incision. We're going to excise the iris that's coming out through the paracentesis. We're not going to try and reposit this because it's probably covered in epithelium, whether it's corneal or conjunctival. It probably doesn't matter, but we don't want to get epithelial ingrowth. And that does actually free up a large flap of iris, which I think we'll be able to bring across to the other side. There's several areas of posterior synechia, and to really see how this iris is going to react, we're going to have to remove that, and we're trying to stretch and remove as much of the fiber membrane as possible. You can see by doing that, there's a fair amount of hemorrhage that forms in the eye, and we'll keep clearing this with either OVD or the IA throughout the case. We're trying very hard not to make an extensive amount of hemorrhage, otherwise the fiber membrane that we're trying to remove here with scissors is just going to come back. So before we do the iris repair, it's important to remove the fiber membrane, because once we suture the pupil down, it'll be much more difficult to get a large excision of that fiber membrane. And you can see here with a Utrata, microforceps, and a micro scissor, we're able to excise really large chunks of that fiber membrane, exposing the implant below. Luckily, the IOL was nicely placed in the capsular bag, and so all we had to do was remove the membrane, and it really should allow for better vision once everything is said and done. And there you can see that opening in that relatively dense fiber membrane that had covered the anterior capsule. The Ayres microstent, I don't think was actually properly placed. It was on its way in when the patient moved and then was kind of left there. So we're just going to uncover it from some of its adhesions, and we're just going to remove this. It was relatively straightforward to remove and didn't cause too much trauma. And now that the hydrus is out, we can move forward with the remainder of our iris repair. Remember, that first step was try and bring those two kind of flaps of iris together. So here we are using a 10-0 polypropylene suture. We're going to try and reapproximate the proximal and distal ends of that iris defect to start the recreation of the pupil border. That's a CIF4 needle, and it's going in through a paracentesis, and we're going to exit the needle just by pushing it through the limbus. There's no exit wound there. You do need to be careful when you do this because you can leave a suture tract leak, although we got lucky in this case, and by the end of the repair, any leak that was there had already sealed off. We'll grab the distal portion of that suture and bring it through the same paracentesis as the entry wound, and then we're going to close this off using a Condon modified sliding knot. And I'm not going to go too far into how to tie this knot. There are other videos, including my own video on YouTube, that can show how to do this. But you can see now after one and the second suture going in, we're beginning to reconstruct the pupillary aperture. And so far, I'm actually very impressed at how much elasticity this pupil had retained over the course of a couple months while the initial hemorrhage had healed. So here's suture number 2 going in, and we'll once again tie a sliding knot to get this iris closed. And again, throughout the case several times, although I'm not always showing it, we're going to remove some of that blood, either using the IA or by just placing additional OVD. Now it's time to do the dialysis repair. We're making a small conjunctival peritomy, and I'm going to use a 25 gauge guide needle to show myself where the exit wound is going to be, and using another 10-0 polypropylene, this time on a straight needle, or the STC6 needle, we're going to make 1 or maybe 2 mattress sutures. These are actually a bit challenging because that needle is really, really thin, and it's hard to control the needle as it goes across the anterior segment. But here's suture pass number 2. Now we're grabbing 2 parts on the peripheral iris, and the we're grabbing closer together than the exit wound. So it's actually going to splay the iris apart a little bit when we pull that back to the scleral wall. We'll tie that polypropylene suture, and eventually that knot will get buried into the needle track. So we're not going to leave any knots exposed on the scleral surface. This is that last little part of the iris that was really stuck down, and we're just going to do a little pupiloplasty here to bring that peaked area of the iris together, and that's where, in the same vicinity as where that iris was stuck to that paracentesis when the patient came in. So here you can see, after closing the peritomy, we actually have got a pretty decent pupillary aperture, and it's right over the IOL. So when all said and done here, I was very happy with the repair job we were able to give this patient, originally thinking that she may need an artificial iris. But here you can see the before picture as well as the after, and this patient's done very nicely, eventually regaining vision of approximately 20/40 within a month or two after the surgery. So hope you enjoyed. It's been a long video, but thanks for watching.